Without spending time, I would like to request Mr. Kundan Kumar Lal, a giant in the field of artificial intelligence. Mr. Lal, sir, please.
Okay. So let me, I had the Manishji's also presentation. Definitely technology has got a lot of inputs into any disease management, not only COVID, but any disease management. And in pandemic situation where there is a survival comes at stake, it plays a very vital role. And specifically, as my focus today is more on AI. AI has played a very distinctive role in not only coming out with the vaccine pretty fast, but also testing it for FDA approval or for ICMR approval to be launched. AI has played across the globe a big role, and so that it becomes very, very critical. But before I start, let me introduce myself. I am basically, I head an organization known as Vithi Research Foundation, and our focus has been AI, or we call it AI Emerging and Foundational Technologies, AI EFT technologies, or emerging disruptive technologies. Okay, so these technologies are quite disruptive, and the narrative we carry that AI is transforming the world. We haven't seen this particular technology, which we also denote as an Industrial Revolution 4.0, is drastically changing the world as we know today. Okay, and our generation and the next generation will be living in a completely different world, which is enabled by AI, or Industrial Revolution 4.0. So that's the world we are leading to, and we need to be much more aware of it. So that is where we work. We work more in developing social impact and public benefit applications with the Research Foundation. We have got another organization, Ativiti, which is more like a monetization arm, or you can say the commercialization arm of the AI technology. We are also into skill development. We are working with a lot of institutions and universities at this point of time, few of the IITs, and we are helping them. We are intervening with them into bringing an AI education and also helping them in make their students' hand dirty and help in also doing a faculty development. So from the skill development to AI-based application development, both area we actually work upon. So without ado, let me go ahead and take you through the slides itself. So if you look from the AI perspective, but today itself, AI is all around us. Okay, we identify it, we understand that or not. AI is all the way we socialize, the way we travel, the way we do business, the way we do politics, the way we shop. Everywhere AI is. Okay, let me give you an example. The way we do politics, I mean, Bihar specifically is very much ingrained with politics. So I will take that example. When President Trump won the election with only 110,000 votes from Hillary, it was denoted to and it was referred to that Facebook AI actually helped him. And you know that he won the election only 110,000 votes in only 3 states. That was Wisconsin, Michigan, and Pennsylvania. And 110,000 votes is a pretty low number, right? And this edge was provided by Facebook AI. So one day before the election, Facebook AI, and by the way, Facebook, when you upload a photo, there is an AI system there which knows you exactly who you are, what kind of leaning you have. I mean, what kind of post you put on Facebook, what kind of post you like it. Okay, all that they know. So you are supporting Modi ji, or you are supporting Congress or any other political organization, Facebook knows about you. Okay, he knows about who you are, who is your family members, who is your wife, who is your kids. It knows everything about you. So Facebook AI identified those people who had a leaning towards the right wing, or say Trump, leaning towards the Trump. And they sent out a message to all of them, okay, that your friends are going to vote. A simple message. He sent it out the day before. Your friends are going to vote. Are you? And it put 12 of your friends' thumbnail down below. All very close friends of yours. So when this was done, they say that 375,000 additional people went to vote, and they were all right wing. Okay, and that was the reason Trump became the president of America. So you can well imagine the kind of influence AI can bring in politics. Let me give you another example, the way we shop. Amazon, it was early discussion, Amazon came up. So let me give you an example from Amazon. In Amazon, the current model of Amazon is where you shop, you go to the site or on mobile device or on your browser, and you go and shop thing, you pay for it, and the delivery boys come and deliver it. You buy one day, you buy 5 things, 5 different guys comes and actually delivers. Okay, and that increases the burden on Amazon. So Amazon burden of transportation itself or logistics cost is $3.57 billion worldwide. So Amazon is quite worried about it, that how do they bring the cost down? And Amazon is a company who also provides a lot of AI solutions. So they have got the cloud, we call it AWS, Amazon Web Services, and they leverage a lot of AI. So if you know about Alexa, that's an AI, right? So they are deploying AI to understand what is that, how do you search? So they are sharing data. How do you search? What you are searching for? How do you buy? What kind of quality products? What kind of payment structure you have? How much cost you actually bear when you are buying things? You pay high or you pay low? So what kind of buying behavior you have? All that they look after. Okay, and that is where they are now planning to predict that what is you going to buy tomorrow. So what will happen is that one day, one morning, you will wake up and you will see that when you open the door, you will see Amazon box in front of it, and you will open the box and you will see 15 things are there with that you ordered that day. Okay, so that is what you will watch. What is that you ordered, and that will be there on that box, and you will be amazed. You wanted milk that day, the milk is available. You wanted some a mobile device, it was there. You wanted some sabjis or vegetables and whatever, and that will be all there. You will take out those things which you require and leave it on everything else there. Now, once you do that, the Amazon buy guy will come and take it away. One Amazon guy, he will come in the morning and put everything. That will bring their logistics cost down. Okay, and this prediction they have already started implementing. So the model which is today, we call it shop and ship. And tomorrow, Amazon, with help of AI, is bringing a model which will be known as ship and shop. They will ship it to you, and then you will find out things which is required by you. And AI is making it happen. So these are some of the examples. Very powerful tool set which this AI is. I hope you are still there, guys. You are listening me.
Yes, sir.
Okay, wonderful, wonderful. So let me also take you through. So if you look at, I mean, it's very critical that we understand AI. So if you put that AI word in Google, you will find a lot of words around it: neural network, planning, robotics, ontology, natural language knowledge, that is ontology, cognitive system, perception. All these words are there, which actually denotes AI. AI is a very large word, and machine learning and all is defining what AI is. Okay, so that these are all the words you'll see. So let's try to understand what AI is in a very nutshell. So AI, if you look at, we can categorize them into two factors. One where the humans are still making the decision, we are still making the decision, and another way where we humans are not making the decisions, AI is making the decision. Where humans, we are still making the decision, there are two kinds of AI. One is we call it hardwired or specific systems, or the assisted intelligence. Or the second is where we call them adaptive systems or augmented intelligence. Now, what is the difference between these two? The difference between these two is very, very simple. One is that we train AI and we give it to you. It augments you in making decisions, but it doesn't learn further. Okay. The another way is the AI, which actually, once it is trained, it is given to you, but it starts learning from the environment. So the kind of the decisions you are making, it knows about it exactly. Okay, and are you still able to hear me, right?
Yes, sir.
Oh, wonderful, wonderful. Sorry. So my power conked off, and let me give me a second. I'll put my screen up again, and I will go for it. Right, right. Give me a second, gentlemen. So, right. So this is where we are. We were. And augmented intelligence continue learning from the environment. That is what is happening with augmented intelligence. Let's go to the second side of the screen where there's no human in the loop. Now the automation is the standard industrial automation as we know of. So you go to a Volkswagen factory in Munich, you will find everything is automated. Okay, with very few people, very few humans, and the car is being made. So there is a chain there, and the car is there. Few robotic arms are putting their nut bolts. Few robotic arm is putting.
Excuse me, sir.
Hello.
We are not able to see your screen, sir.
Oh, you are not? Okay, let me re-share it back again.
Yeah, it's visible.
It is visible now?
Yes, yes.
So that is an industrial automation where robotic arms are putting the screws, they are painting the car, they are putting the glass, the interiors, and it is moving on the conveyor belt, and the car comes out from the other side. Okay, so that is the industrial automation. The humans have written all that code. They are not intelligent. There is no AI there currently. They are all code which have been written by the humans. Okay, we call them linear algorithms or linear systems. Now, but there is another one where we humans are still not in the loop, and it is making decisions. We call them autonomous intelligence. And all the fear emanates from the fact that autonomous intelligence is coming in. I can give you one example. The car. Okay, so if your autonomous car, if you have heard about it, it's already reached level 3. It is driving in US streets and other developed nations. They are delivering pizza, they're delivering people from one place to another. They are the autonomous car, and very soon it will be there in Indian streets too. Okay, the challenges are there. We need to have more offensive algorithm here in India, but autonomous vehicles are going to become available in India too. So they are known as, they are making the decisions. They look at the roads, they are looking at the weather, they are looking at the potholes, they understand who is sitting inside, and they are driving you. So these are the autonomous intelligence, and there is a lot of fear factor with this autonomous intelligence. How do we ensure that we make good AI or a bad AI or responsible AI? So these are the terms we will hear: responsible AI, good AI, and this is all comes to the fact from autonomous intelligence. Let's go a little further. So the way and the world you are living today, this is the world of artificial narrow intelligence. There are very few. This narrow intelligence is a machine learning, or the other words we call it machine learning. It has got a very limited capability. The current deep learning platforms has got only 2.5 million neurons, which is equal to a machhar ke dimag ke barabar hai. So it's like a mosquito brain, and so small, but it's already changing the world. You can well imagine when we will go to the next level, that is the human level brain or the simulation or the algorithm. You can well imagine the impact it will bring on the world. So एक मच्छर जो है यानी this artificial intelligence 2.5 million neurons is already changing the world. Everywhere you are hearing AI. It is playing a role of a driver, a writer, a stockbroker, soldier, a machine operator, translator. It is everywhere. So the current GPT-3, which has been simulated, it has been trained on 147 billion parameters. You can give a word and it can write the whole book for you. Okay, that is the capability which is already there. And Microsoft has recently come out and invested $1 billion. They have given to a foundation known as OpenAI, similar to the Visi Research Foundation in the US, and to develop AGI technologies or artificial general intelligence technology. To understand this better, a narrow intelligence is a machine learning world which learns one task. So if you teach him how to fly a plane, it will do that. But if you go ahead and again teach him how to drive a vehicle, it will forget about flying the plane. Okay, so it can remember one task, or we call it a catastrophic interference. It forgets the last part of it. Okay, so it is a very limited capability. But AGI is like us. So we learn cycling or swimming in early childhood, and later on, any point of time, somebody gives us a bicycle or throws us in water, or we go into swimming pool, we know how to swim, right? We don't forget it. So we learn and we don't forget. That is the capability which human brain has, and that is what AGI will be having it. Second, current technologies or AI operates upon a structured data set, which is very, very limited capability. Okay, but very soon you will have a capability where it will not forget it. It will process the data set in a very, very critical unstructured data set. So we operate on 5 senses. We operate on the touch, the classical part of olfactory, the smell, the hearing capability, and the taste buds, right? And the vision. These are the 5 senses, which is we call them unstructured data set. AI or AGI will start operating upon unstructured data set just like us. Okay, not in the structured data which AI operates today. So applied AI or ANI, and very soon after AGI, the world which every company in the globe or every large countries like America and China, they are investing. So America is putting up $3 trillion into AI research and implementation. China is putting $147 billion into AI. Okay, they have adopted a strategy. IBM, Microsoft, Amazon, Google, Apple, they have all made hands. And they have created a strategy, they call it AI first strategy. हम जो भी करेंगे AI के साथ करेंगे. That is their strategy they have adopted. And this all technology will take us. So the whole idea is why they are investing money, because they want to reach to a level we call it artificial super intelligence. And if after AGI, the ASI, the super intelligence, आप उसको अगर समझना चाहें तो बड़ी simple सी बात है. If you put all the knowledge set of world, okay, all the human knowledge set, all the branches of engineering, science, art together into one brain, that will be super intelligence. That will be artificial super intelligence. We humans operate at 90 to 140 IQ level. ASI will operate at 12,500 IQ level. AGI will operate at 5,000 IQ level. You can well imagine the impact of this on human society. Okay, so let me go ahead. We can talk a lot about it, but let me go ahead. I hope you are still able to see my screen, right?
Yes, sir.
Okay, wonderful. AI today's paradigm, if you look at, okay, the unsupervised learning, which is there, it learns from itself, it generates a note in AI, own understanding, the unsupervised learning, that's very, very critical. The technology has reached to that stage. Your data is going to be private, but there will be a small AI sitting into mobile devices. So the collaborative machine learning without centralized training data, AI will be actually learning from your mobile device and giving it to a central brain. So your data will be still private. But this federated AI is becoming a big concern because it will take away your learning and move it to the central database. Governments are working on that kind of scenario. It is already there. It is, we call it less than one shot. In one shot, it will learn things. So we take a lifetime to learn about it, to read digits from 0 to 9. But AI, even this kind of one shot, it will learn immediately. Any human who will write 0 to 9, it will understand what he has written. Okay, by learning in 1 second or a few seconds, a few milliseconds, by using less than one shot algorithm. So this is there. I'll give you one example. The Google, they had this AlphaGo, and this defeated a world champion known as Lee Sedol in 2015. They developed AlphaZero after that. So AlphaGo, which defeated Lee Sedol, the probability of human winning from it was 4%. But AlphaZero, which actually learned from AlphaGo, I mean, that's the capability of AI. It never played with any human being. It played with AlphaGo, and they call it AlphaZero. The probability of human winning from it today is 0%. We cannot win it. And understand one thing, that why they're developing these kind of game applications leveraging AI, when the balloon will be up or we will be against them at some point of time in a war scenario, their commanders will have AI to assist them, and we will be not able to win because AI that time will be so powerful, just like AlphaZero. The game strategies will be so powerful. That's the narrative. That is something we need to understand too. So the internal security we do has got a lot of risk, and we need to ensure that we invest into AI, we bring it to our curriculum. We have got a large capacity there, and leverage those capacity to play into Industrial Revolution 4.0 space, be it healthcare, but we need to play. So if you look at from the AI map today, okay, in every industry, from automotive, manufacturing, consumer, finance, agriculture, AI is there. And that is a narrow intelligence, ANI. Okay, so we are living in a world of artificial narrow intelligence. So real-time optimization, strategic optimization, predictive analytics, predictive maintenance, these are some of the capabilities ANI can do. AGI will do a lot more, but ANI currently do these kind of things. And you can see well the capabilities are lying today, right? So where we are leading to? We are leading to our hyper-competitive digital enterprise. This is the world which is coming in. The world will play with foresight now. Okay, it will be a declarative world. So we will be not a problem will occur, and then we solve today. We write a standard operating procedure to solve a problem. No, tomorrow's world, any organization, be it government, be it academia, be it industry, they will be hyper competitive. We call them hyper competitive digital enterprise. You will be predicting things, what is going to happen, and then take action. So we will know exactly that what is going to happen next by leveraging AI. Obviously, AI will be there. That is the world we call it declarative world, and the foresight. And then you will take actions. You will never let it happen. That is what AI is bringing in on the table. And this is all data, guys. So the data which we are generating humongous amount of data. And that data is now an opportunity for us to implement more and more algorithms there, more and more solutions there. And it is only our imagination that how many solutions we bring it in. Be it even COVID-19, I'll come to that. The AI is going to be a big, big force there. Okay, if you don't have an AI strategy today, you are going to die in the world that is coming. Okay, that is David Wing, the CEO of EEB. And it is right for the government, it is right for any industry, it is right for academia, and we need to learn and start working towards it feverishly, gentlemen. So let's look at from the perspective of AI in COVID-19 disease management. Okay, and obviously it has got an implication because we are a rural world, over a lot of population lives in villages. We have got a very large illiterate mass to handle it, and that is where AI interventions can be a great beneficial and fruitful for us. So some of the areas where AI can intervene are like prediction and tracking. So you know the Arogya Setu is there, but there are a lot of other applications. Contact tracing. Have you met somebody who is already sick? Monitoring of COVID-19 diseases, so it can reduce the burden of the hospitals to nurses and doctors. Early diagnosis. Can you get an early? So this time in the second wave, you saw a lot of young people collapse due to COVID-19 because they were not diagnosed earlier. Okay, and the COVID reached to their lungs, and that was the reason of need of oxygen and a lot of deaths which occurred this time. Early diagnosis becomes very, very critical. Protein structure prediction for disease management, specifically the development of medicine, development of therapeutics, the kind of हमने इस बार काफी काढ़ा पिया है, and आयुर्वेद की काफी दवाइयां पतंजलि से खाई है. Okay, but there is a limitation to it, and there is an impact of it we need to understand. AI can help us in these kind of natural medication, understand the impact on a human body and help us there. Development of vaccines, you know, the storyline is very clear. We got our vaccine in 1.5 years, which actually takes around 12 years to develop. This has been curtailed. AI has been an input. If you read about Pfizer and all, there have been a lot of AI. They leveraged it actually. Curbing the spread of misinformation, genomics, and reducing the burden from caregivers. These are some of the areas where AI can impact. Let's try to understand it. I hope I'm still there, gentlemen. Are you able to hear me?
Yes, sir, you are all audible.
Okay, wonderful. So prediction and tracking. Let me give you one company. There is a company known as Blue Dot. Okay, it was developed by a guy known as Kamran Khan, and it was this is a 12-year-old organization. And what they did, they are leveraging AI to predict pandemic. So if somewhere something happens, they can predict there is a pandemic coming in, and we need to start fighting. Okay, either we stop traveling or stop the air travels so that it doesn't be spread from that country to another country. What they're doing, they're leveraging AI to, AI does what? AI basically works on data, right? So they are analyzing humongous amount of data. Your official public health organization, digital media. So somebody is on WhatsApp or on Facebook or on LinkedIn, somebody is talking about some disease somewhere. Okay, digital media, global airline ticketing data, how somebody is sick, who is traveling where to get medication, or medicines are being flown to one point to other point. Livestock, are the livestock falling sick some point of time somewhere? Okay, and they can understand it. AI can understand, oh, there is a pandemic coming in. Health reports. Okay, so a lot of health report. You go to a doctor or you go to a hospital and you report about your and that they are doing the diagnosis. This Blue Dot is actually tracking those kind of data. Population demographics also, where the people are going, where the people are concentrating, how they are interacting. all the data around you, what kind of search you're making on Google, okay, or what you're reporting on your Facebook, what kind of things you're posting, and then it is predicting that there is a pandemic coming or not. This will be an early prediction, okay? The similar organization is there, Health Map. It does the same thing. They are not only prediction, they are tracking it, okay? And they have proven their worth into earlier disease tracking like SARS-CoV-2 last time. And this time also they actually 8 months before they predicted about the pandemic when it happened in Wuhan. Obviously, we never took care of that. We never woke up to the fact, but they predicted early. Later on, who actually is. So this kind of technology based on AI is going to be leveraged in coming and next time onwards more and more, right? And technologies like Blue Dot and Health Map, we are being tracked, gentlemen. What I'm trying to say, okay? Contact tracing, it is very, very critical, and this time we have seen it. And AI is being leveraged a lot. Every country worth its salt has launched an AI-based contact tracing mobile application. We got Arogya Setu, obviously on Bluetooth technology. They know exactly whom you met. Are you in a green zone or not? And it used to tell us that, hey, we're still green. How many people are there around us who have fallen sick in 500 meters or 1 kilometer? Okay. So, these kind of AI-based contact tracing mobile applications, they're using Bluetooth, GPS, social graph, and your contact details, network-based AI, mobile tracking data to actually tell us that are we in a risk now, okay? So what they do, they are leveraging like Singapore MES systems, AI-assisted contact tracing. They are doing proximity tracing. Have you gone near a COVID-19 patient? If you have been, you will not know, but system knows exactly that somebody is sick and you have gone near him. It will tell you to start taking a precaution, early precaution. Start taking a steam or start taking a gargle, all those things, right? Journey mapping. So if you are traveling from metro or railway or bus, it can tell you, is it a hot spot? Are there more people there into that train who are sick already with COVID-19? And it may be a hot spot. You may avoid that. So it can do that. It is already doing it. Hot zone alerting. You're going to an office to have a meeting there, and it can tell you how many people in that office is already having a COVID-19 suspect. Okay, so you may decide not to go for that meeting. Is it a hot zone? So, or you can take care about it. You can wear your mask or more sanitization approach, you can take it. So they are doing it. Look at the other example, that is Canadian Face Drive Trace Scan Contact Tracing AI platform. They are doing the similar too. They are using your Bluetooth. Your Bluetooth is on. Your data set is available and it is analyzing, taking the data and analyzing it. So AI algorithm provide information about your physical distancing, the isolation measures you have taken, okay, who has tested positive, the result of it, they're spreading it across. And so these are some of the measures which they are doing it to support you, help you, and do a contact tracing to keep you safe. Okay, so AI is playing a lot of a role here, and AI algorithms are improving the contact tracing accuracy and real-time monitoring of the recovery progress as well. So measurement of specific vital signs. So that is where we will go there. That how it is also helping us in managing us. So in monitoring and helping us. So the second part where the AI can play a more role is early diagnostics. I told you early time. And if you look at, there are a lot of applications. Recently, I was talking to one of the directors of an institution. He came out that one of the American companies has come to India with a very high resolution camera. And what they have developed is they have developed an AI-based solution which will take a photograph of your mouth. You'll open your mouth, it'll take a photograph of your mouth, and it will go down and actually identify that how many virus is there in your mouth. Okay, so are you a spreader? Okay, you are already infected and you are spreading the disease. It can predict it by the numbers of count of virus in your mouth. Okay, so you don't have to do an RT-PCR. It will just take a photograph and predict. If the way you cough, okay, so when you are talking on mobile phone, these devices can actually tell us that are you infected by COVID or not. Okay, and you must have heard about when Sushant Singh Rajput died. Sushant Singh Rajput actually was thinking through of developing an application of AI-based application to develop it, that when you are talking, your voice can predict an infection, that are you already having a COVID infection or not. But very interestingly, and another application which has been developed, which actually detects AI from cough detection. Okay, so when you cough and when your phone is on, this application is there, it can immediately tell you that you are already infected with COVID and your coughing behavior and pattern has changed. Okay, so photonics tools such as near infrared spectroscopy, just like what I talked about, they are being deployed now for early diagnosis of these kind of diseases, and these will be very, very powerful if it can diagnose and tell you about that you are infected with AI or not, infected with disease like COVID-19. Obviously, you can predict about other diseases too, right? So cough detection, talk-based, this is all AI-based technology which is coming in for early diagnosis. So I believe the world, as it is progressing, the next time any pandemic probably will be better prepared to fight against it. Infrared tomography, last time Manish ji was talking about, obviously computer vision is being deployed there. The cameras, the CCD camera which is there, infrared camera, they're already looking at you on airports and malls and offices, and the AI sitting down at the back end is predicting that are you having a fever or not by your temperature, okay? And this AI, we call it music actually, multiple signal algorithms. They are being, computing algorithms are being used to actually identify that you are having a temperature or not, leveraging the CCD camera. So they can also detect about you. They can also diagnose early and let you know. There is another technology set which Manish ji pointed out, and by the way, we are also partners to IIIT Bhagalpur, and Dr. Sandeep and Arvind ji, they actually developed this X-ray based software which we have named CoVision. It is under ICMR approval currently. It will help us in doing an early diagnosis using your X-ray. So what happens is when you are infected with COVID, it goes to your lungs in 4 days time, right? It remains in your throat and in a prenasal area, and around 4 days it actually reaches your lung area. When you get infected in lung, then and this variant actually has progressed very fast into your lungs, and the SpO2 measurement, you will only know your lungs is infected by SpO2, but that time when your oxygen level start dropping, your lung is already infected more than 50-60%, your lung has been destroyed, okay? And you will need oxygen, you will start coughing more and more, right? And that has also resulted in a lot of deaths this time, a lot of pressure on our healthcare infrastructure this time. But if we can take an X-ray and that X-ray is given to AI can tell you how much your lungs are infected. It is mild, moderate, or severe. And this software already developed now. We call it a CoVision software, okay? And we are already taking it to hospitals. We are proposed to the government, and I think this should become the part of the standing operating procedure, and it will be very, very cost effective to tell you that you are infected with COVID into your lungs, okay? And stop the death or reduce the death due to COVID. So that is AI is playing a big role here. Let's go to the another part of the storyline, monitoring of COVID-19 cases. So hospitals are very, very hard pressed. The condition monitoring, leveraging AI is very, very critical for us. Okay. So in hospitals, AI is being leveraged today for remote monitoring of patients in clinical settings and prediction of course of treatment. Everybody cannot go to hospitals, gentlemen. So you are at home. If you do have an AI-based remote monitoring application, it can actually monitor you and give doctors an input that how you are progressing. Similarly, if you are even in ICU, okay, there are a lot of parameters of yours are being monitored. AI can help doctors there, because you know what, this time when I was visiting some of the hospitals, I came to know doctors are very much afraid, nurses are very much afraid to actually visit the COVID patients, right? So they used to visit only once even into the ICU where somebody is there to monitor somebody, or you are hospitalized in room. They used to come only once over the day. That is where AI can play a role. AI can monitor you 24/7. So if your conditions start deteriorating, if AI can generate an alert quickly and tell the doctors to come in, be it your respiratory rates, cough, blood pressure, oxygen saturation. It can monitor all these parameters and generate an alert based on your criticality. Based on data derived from vital statistics and clinical parameters, AI can provide critical information for resource allocation. This time you must have heard a lot of story like in Karnataka, people, the hospitals or the people in municipalities, they actually were selling the hospital beds to the people. So they were blocking the hospital beds with a patient who doesn't need hospitalization, and then somebody who is critically ill used to come in. They used to charge them 50,000 and lakh of rupees to give them a bed. And we know we humans are like that. I mean, we are, I mean, I don't need to say that, but that's very, very pathetic about us, about human beings. So we have been doing business around it. AI can play a role there. So if you go to AI can actually monitor, look at your X-ray scan, and immediately tell the application or the hospital that this gentleman needs some hospitalization. Okay, and it will be unbiased support for you. Okay, we need not depend upon human beings for a critical infrastructure allocation like hospital beds. That is where AI is playing a role, and that is where we need to depend upon AI more and more, right? So the condition monitoring, allocation of infrastructure, or monitoring the disease progression, AI is playing a role there. We need to look at this particular thing more and more. So I will go to the next part of it where AI can play a more role. AI is helping us to come out with medication. We call it a protein structure prediction, where AI can look at the sequencing of the protein and predict that this particular medicine which is being developed can be very, very effective for any disease like COVID-19. Okay, so AlphaFold algorithm was developed by Google DeepMind, employed, they actually leverage an algorithm, we call it residual networks or ResNets, for predicting protein structures of membrane protein, like 3A, NSP2, NSP4, and papain like C-terminal domain for SARS-CoV-2, COVID-19, which will give human impetus to drug discovery programs in a much more shorter period of time. Okay, deep rate tracing, that's another algorithm. They have been also leveraged for protein complex structure predictions. Okay, and this has also cut down the time to develop medication for treating COVID-19 kind of pandemic. Okay, where we are very hard pressed and we need to come out with medication pretty fast. So development of therapeutics, vaccines, genomics, AI is playing a big role there. AI reduces time required in bringing a drug from bench to bed by speeding up lead discovery or virtual screening and validation. Okay, so it will not only develop the medication, but also cut down the time when we are experimenting, we are giving it to animals or human beings and trying to understand the impact of it. Also, you know that a lot of disease we can fight naturally, right? वो हम लोगों ने काढ़ा पिया है, पतंजलि खाया है, right? So, and we have been having this lemon and honey and all those things, but it does have a lot of impact on our immune system, right? AI can help by monitoring this. AI can tell us exactly what kind of natural medicine will help us in certain disease scenario like COVID-19. Okay, we need to leverage AI there, and it is being leveraged for those kind of things too. Okay, so AI has accelerated the pace by deriving useful data for drug repurposing or drug repositioning by screening properties of already approved and validated drugs based on molecular descriptors and properties. Okay, so it is already there, turmeric and all, it is monitoring and helping us there. AI is being leveraged for that. Obviously, I will not walk away from the vaccines part of it. This time, Pfizer leveraged a lot of AI based algorithm to come out with a vaccine very, very fast. Okay, and I think going forward, a lot of medicine and vaccines will be developed leveraging AI only. Probably AI only will be coming out for these kind of medication and the targeted medication. I mean, not only a generic medication for human beings, but also depending upon DNA. So AI can look at us, our DNA, like my DNA, and come out with a medication which is targeted for me, which helps me in recovering much more faster. That is the power of AI which is being leveraged now and increased being leveraged. The other aspect of AI was curbing the spread of misinformation. On WhatsApp, we have gone through, we have seen so many people coming out with different kind of information, and we call it what? A WhatsApp university, right? So we on WhatsApp university, a lot of people telling us, "Bhai, हमें ये करना चाहिए और वो करना चाहिए, which will help us take care of COVID." And a lot of these information were misinformation. They were pathetic information. They were mischievous information, and they were outright evil sometimes, right? AI can help us in identifying these messages and take it away from Twitter or from WhatsApp on Facebook So people who can, some people like you who are quite intelligent and educated, they may not fall for it. But people who are less educated, who are not so literate, they may fall for this information. And you know, we all are on Facebook or on other like WhatsApp and all, right? So AI can help us in identify these kind of information and curb them at the root itself. Okay, we call them deepfakes, and we are working into that technology set as well. It can identify trends and sentiment analysis and provide information regarding the origin of false information also. Track the resource source part of it and stop it at the source itself, right? On curtailing these rumors and misinformation. So आपने सुना कि वो गाय के calf के खून से बना हुआ है on vaccine. People are very much afraid in taking it. आप vaccine लीजिएगा, then you will have a potency issue. I mean, you will be not able to produce kids. This is also came out. A lot of these kind of misinformation can be taken care by AI, and AI is already working on it. And it can also present a clear picture of recovery rates, accessibility and availability of healthcare. So you must have seen a lot of applications has now come out. So you go to these applications, it exactly tells you which hospital has got how many beds available. So you don't have to rush from one hospital to another and where the oxygen is available. So these kind of applications has come out which leverages AI a lot. Okay, and this will help us in coming days in achieving some of the better medications, better medicine infrastructure and facilities. Okay, and emerging evidence also. So, agar wo nimbu and honey, it works better for us. AI can actually monitor and tell us, yes, it is better for us. Like we came to know about the steaming part of it. When you start taking steam, it helped us in containing the COVID on a pre-nasal stage itself, right? So AI can monitor that and help us in taking this information for an effective treatment or stopping the AI in its early stage, the COVID in its early stages. So, and the most important factor, let me come AI, it is taking and reducing the burden from the caregivers, gentlemen. So a lot of robotic-based implementation has been developed where it is going to the COVID-19 patient with medication, with food. These kind of robots have been developed. Like a squad of robots for the first line defense against person-to-person transmission, which actually look at your temperature, look at your coughing behavior, how you are walking, and these robots are actually predicting and telling you that you are infected or somebody is infected, and others need to keep away. RT-PCR test, right? You all of us probably must have gone through this now up till now, and that is where AI-based robotic implementations have been developed, which can go to you, automatically do RT-PCR, put the dart into your mouth, the swab robot we call them, and give it to the other applications to analyze quickly and predict. The sanitization part, the AI-based robotics, which has got the ultraviolet ray coming out of it, has been deployed in hospitals in developed nations and probably in India too. In some of the hospitals, they have started doing it, which can sanitize your bed, your environment using the ultraviolet. And it navigates automatically. It is like an autonomous vehicle. It knows exactly its path, where it goes, leveraging lidar, that is a laser-based lidar. It is doing that. So AI is all around you, gentlemen, now. So what I say is that AI intervention in pandemic response and containment, okay, they can have two, on health part of it and society part of it. And then it can play the role on detection and then the action. So these four parameters we need to look at, from disease detection, social dynamic detection, medical actions and tracking actions. AI is playing a big role, gentlemen, there in this all area. Okay, and it can help us adopting a three-pronged approach on testing, isolation and contact tracing to combat COVID-19 scenario. And it is very much effective into a general population like we do have, which resides in rural areas, and more. This becomes very, very critical for us. So that is on the part of COVID. Let me tell you one thing, what we do quickly before I end my presentation. We work on AI technologies. We develop a lot of products and applications. We are working on that. We do, and we also help institutions in doing R&D and make the students' hand dirty. That is the part of our education system. We are on rescaling, certification, and accreditation. We help institutions there to deliver more better AI education, be it management, be it engineering, be it R&D institutions. And we work on social impact. On Academia Connect, like we are developing AI-based AI innovation centers. We have recently signed in Bihar also with IIIT Bhagalpur to establish an AI innovation hub there, and also train and help the students gaining practical applications, be it on healthcare, be it on manufacturing, automotive, wherever. I mean, every domain we can work on management aspects, on HR management, on CRM, on SCM, supply chain management. And we have developed a network of administrators, mentors who help them from the industry and all, who help and handhold the students and the faculty to go into AI space. That is what we do, gentlemen. And we developed a lot of AI-based social impact, public benefit, right? So that is what we are doing. We are partners to multiple from industry, technology like IBM, Lex Technologies in Australia, associations like leadingindia.ai or NDRI in Nepal, or to TBIF in IIT Ropar. We are working with a lot of universities and institutions. We are establishing this with the infrastructure initiative. We call it AI Innovation Hubs. We are handholding in universities and institutions in establishing AI innovation centers so that they can research and develop projects on AI quickly, from fintech to healthcare to all the aspects. And I'll request all of you educators to all to look into that space. Our intervention in the skill in academia, in business, in community, and to the government as well. We are helping them. And a lot of courses like with IIIT Bhagalpur, this time we have launched a postgraduate diploma program in data science and AI, on machine learning, on analyst, being an AI master analyst on deep learning platforms. So we help them in sensitization, in faculty development, and also a project-based learning. We work on multiple projects from healthcare, finance, technology, education. We are developing a product, we call it Sarthik, which may make learning more pleasurable, or a project like Doody, a robotic implementation which will have a huge impact on environment. So we are working on that. So please join us. You can join us on LinkedIn, on Facebook. We have got Women of AI group there on Facebook and on LinkedIn. AI for Humanity. You please join us. We have got Community Hurdle, Industry Leaders Roundtable. We do a lot of events, and we have got also a group of vice chancellors where we work with them very closely, and institutions. Thank you, gentlemen. Take care.